Hello, everyone, and welcome to the AWS Healthcare and Life Sciences Web Day. My name is Wilson Toe, and I head up our worldwide business development practice for healthcare across AWS. I hope this message finds everyone safe and well, given the unprecedented times that we live in. But today I wanted to showcase for you some of the work that our customers and partners have been doing to accelerate healthcare transformation across the industry. If you take a step back and think through the 20 plus years that Amazon.com has operated on behalf of our customers, there are three core ideas that really stuck out. The first has been our unusual customer focus and that customer obsession that drives a lot of what we do on a day-to-day basis. The second are the capabilities to invent on their behalf. The third is that long-term orientation and patience that we have to work very closely with our customers as well as our partners to see industry transformation take place. And a lot of that has come core to what we do at AWS. And AWS is not only the cloud computing arm of Amazon, but it's the cloud computing arm of healthcare organizations all around the world. If you take a step back and think about what customer obsession means to us and the customers that we serve, it really couples around not only the technology, but also the breadth and depth in our healthcare bench in order to best serve our customers. So whether it's subject matter experts or thought leaders from across the industry, ranging from the chief digital officer from a number of health systems, to clinical informaticists that help support and streamline electronic health record development across the industry. We've put together and amassed over 17 plus years of experience through this capability, and have used that to develop our practice, which has gone over 7 years within this space. As you think about some of the core capabilities and how we've coupled this to better serve our customers, it really spans the entire spectrum of care. So whether it's academic medical centers and long-term care facilities, to some of the work that we do with the payers and the health plans, to government organizations like the country level ministries of health, or the healthcare IT vendors that serve the market. Through all of this, what you'll find is that shared mission of not only how are we better able to serve healthcare consumers around the world, but finding ways in which we can help elevate the human condition. And that's what you find commonplace for what we have here at AWS. And you've seen this take form and shape in a lot of what we've done across 2019, as well as even into 2020 now. With Cerner, for example, we've worked to reduce patient readmissions. And not only that, find ways in which we can accelerate some of the work that our clinicians are doing in order to streamline the operational and clinical workflows so that those clinicians can spend less time in front of their computers and more time with their patients. You've also seen this take form and shape in some of the work that we've done with Beth Israel Deaconess Medical Center in applying machine learning and artificial intelligence to streamline operational efficiencies within their operating room procedures. You've also seen this take place in some of the work that we've done with Change Healthcare in support of a broader healthcare data interoperability network. So whether you're a provider, payer, or healthcare technology company, finding ways in solving for that syntactic and semantic interoperability for all Americans has been something that we've been streamlining and spearheading across some of the initiatives here at AWS. You've also seen this take place not only in pure healthcare practice, but also across research. In some of the work that we've done with the National Institutes of Health, for example, in the STRIDES initiative, supporting research and accelerating some of the work from benchtop to bedside. And even more recently, with some of the work that we've done with MetroPlus Health in putting together new outreach tools to address the health and social needs for some of the most vulnerable populations that are sheltering in place in the city of New York. Through and through, what you'll find and learn about today are some of the activities as well as some of the initiatives that our customers and partners have done to really truly support a digitally enhanced healthcare. And that's really started with how they've used AWS to increase their pace of innovation. The second is around some of the core capabilities that they've deployed to better understand and predict healthcare related events related to their members or their patients. So whether it's looking at ways in which they're able to define next best actions that could lead to better outcomes, or finding ways in which they can drive clinical forecasting to better understand who is at risk for what. And third, when you're looking more broadly and have a better understanding of what might happen with your members, individuals, or populations, finding ways in which you can personalize that healthcare journey for them. So whether it's in the form of digital front doors or in digital therapeutics, you'll see a number of activities take place to better streamline that personalized and streamlined experience for all populations. To dive deeper into what organizations have done using AWS to increase the pace of innovation, you'll learn a little bit about the work that the Michigan Health Information Network has done to drive interoperability across the US in streamlining and simplifying the process of supporting interoperability and the exchange of data across the nation. You also learn a little bit about some of the work that Change Healthcare has done, for example, leveraging AWS Marketplace as a broader go-to-market platform to make sure that their solutions are able to get into the hands of those that need us most. So whether it's through simplifying the procurement process to simplifying even the deployment process of those solutions, you'll see AWS take form and shape for how they are able to support partners as they're going to market in development as well as commercialization of their products. Within that second pillar, around predicting healthcare-related events, you'll learn a little bit about some of the work that Cerner has done, for example, to enable a real-time health system using machine learning and artificial intelligence, particularly during the pandemic. You'll also learn about some of the work that GE Healthcare has done to support a broader expansion of some of their capabilities within analytics as well as an artificial intelligence, anchored around what they've done with Edison today and the future of AI and predictive analytics. You'll see it broadly take form and shape in across a number of different settings, from the discussion and dialogue where we see machine learning and artificial intelligence playing a much more instrumental role within the care and practice of medicine, and see it take form in some of the solutions that our organizations are putting into place today. And thirdly, around some of the work that you've seen organizations do to personalize that experience. You'll hear about kind of two different areas where you've seen this advancements continue the dialogue and discussion. The first is around precision medicine and some of the work that HC1 and Quest Diagnostics, for example, has done to support precision medicine at scale in the cloud, to some of the work that even Cofactor Genomics has done, coupling their RNA sequencing with machine learning to streamline that process. Whether it's the case of how precision medicine is done today or how it will evolve over the future, you'll also hear some of the thoughts and discussions from Imogen for a lot of the work that they've been doing across the industry to support the dialogue and discussion of how it can take place in the system today. In parallel to that, some of the work that you'll be hearing also from Force as well as MetroPlus Health, for example, is to really understand how this inbound and outbound engagement can take place in personalizing and simplifying that consumer health experience. So whether it's leveraging data to drive a much more broader virtual care system, to using these types of solutions to engage in an outbound manner, to better understand and engage with individuals, to better understand what their needs are. Customers have used AWS tools to really streamline a lot of the development practice and drive that consumer expectation into healthcare. So as you take a look at these three pillars, and as you think through and work through each of the different sessions today, you'll hear about how AWS has not only helped unlock insights across the entire system, but fundamentally how customers and partners have used AWS capabilities to enable data-driven and digitally enhanced healthcare. Because at the end of the day, it's never a single organization that changes healthcare. It's through partnership and collaboration that you see here today that will really help transform the industry. And despite all of that, it's still just day one here in healthcare. So I appreciate everyone taking the time to learn about some of the work that our customers and partners are doing. Hope you enjoy the rest of the sessions. Thank you.